Welcome to the Physician Pharmacist podcast, a show designed to shed some light on a very unusual pathway into medicine. I'm your host, Nathan Gartland. I'm a licensed pharmacist and third-year medical student. I'm also the author of PharmD to MD and the owner of the Physician Pharmacist company. Most pharmacy students and professional graduates are aware of the possibility of going to medical school, but very few actually take the leap. We are here to unpack some of these details and open your eyes to the possibility of a career in both pharmacy and medicine. I'm very excited for our special guest today, Dr. Abbey Jin. Dr. Jin is a recently graduated pharmacist from the University of Health Sciences and Pharmacy in St. Louis and is a first-year medical student at the University of Missouri-Kansas City School of Medicine. As one of my first students with Physician Pharmacist who has successfully navigated the challenges of the application cycle, I'm excited to have her on the show today. Welcome, Dr. Jin.
Thank you, Nate.
Alrighty, so let's kind of bring things back. And you have a very unique history in the medical school realm. So you would actually attend a medical school with only, I guess, two medical schools in the whole country that are kind of off cycle. And so we're going to explore some of that now. And so I mentioned that you were a first-year student in the introduction, but you're actually technically about to start your second year. So you finished your first year despite it being in the middle of December. So it's very interesting for our guests today. But let's bring things way back. What got you started in pharmacy in the first place?
Yeah, so, when I was in high school, one of my good friends' mom was a pharmacist at Walgreens, and I did a job shadowing program with her. I just, went through a program at Walgreens and just shadowed her for the day. I really liked the impact that she had on her patients on a personal basis. I saw that she was able to get to know a lot of her patients. She knew, you know, exactly what was going on, and she was able to counsel them. I love that personal relationship that a pharmacist had with their patients. So I decided to apply to a pharmacy school that's a direct bachelor's PharmD program. It was called St. Louis College of Pharmacy, but I believe it's 2 years ago or a year ago, it changed its name to University of Health Sciences and Pharmacy in St. Louis. It was a school in my backyard, and they offered a direct program to being a pharmacist, and I just couldn't, you know, um, miss that opportunity.
That's fantastic. So you said it was a bachelor's and then a PharmD. So is this like a 2+4, or was it a longer track, like a 4+4?
So this program it's kind of like a 3.5 plus a 3.5. It's
Mm.
I know. So basically so our fourth year of undergraduate, which is also our first year, so it's 7 years in total,
Okay.
but our first 3 years are strictly undergraduate courses. The fourth year of undergraduate was considered the first year of pharmacy school, and that was a mixture of undergraduate and PharmD curriculum courses.
Interesting. And obviously you got the bachelor's degree. That's something I kind of missed out on with my 2+4 program. And I think a lot of people do miss out on that extra bachelor's. We take enough credits where we're very close to getting one, but then we don't actually get it. So that's cool that you were able to do that, and you did it in 7 years. So I guess you were advancing through pharmacy through this hybrid approach. When did you start thinking about medical school?
Yeah, so I started thinking about medical school probably, I'd say in my third year of undergraduate at the pharmacy school. Also keep in mind that ever since the first year, St. Louis College of Pharmacy, um, well, formerly known as St. Louis College of Pharmacy, now UHSP, they give you a curriculum starting with the biology one that incorporates, pharmaceutics and, drug delivery systems. So even back in biology one, we were learning about, you know, um, hydrophobic patches and how that's optimal for delivery through the skin. So we were learning about, these drug delivery concepts and things that, you would only be learning in pharmacy school back as a first year. So I always had that, curiosity for what is further in pharmacy. But my third year, I started thinking about wanting to transition into medical school because, I did see that, I mean, even though a pharmacist, as a pharmacist, you can do a lot of things, you can do a lot of good in the society. But one of my focuses is that I really wanted to make actionable changes for patients. I became really fascinated with surgical professions and surgical specialties. And I also, instead of managing the patient's pharmacy, the patient's drug regimens and becoming their drug regimen expert, I wanted to do more than that. So I decided to think about transitioning to medicine. I also started working at a orthopedic clinic as a medical scribe, and I really liked that personal interaction that the orthopedic surgeon had with his patients. That was the same interaction I saw that the pharmacist had with her patients. But I love that instead of dispensing medications, he was actually able to talk to patients about what they wanted in terms of changes, and he was able to actually physically make some of those changes. So I love that actionable aspect of medicine, and I wanted to then start transitioning.
Wow, that's amazing. And so you were scribing while in pharmacy school. So you were pretty dedicated to the to the medical school process at that point in time. And that early introduction to pharmacy, I think like that clinical aspect like you were talking about, just in your first year of education, I think goes a long way because you got a head start on your interest in pharmacy, and then that kind of helped you evolve into the medical field. So that's great.
Yeah, thank you. And also, that's why I ended up finishing pharmacy school rather than leaving at the bachelor's degree. It was because, I was curious what is, all that we are learning right now, what will it lead up to in the future?
Yeah, that's a good point actually. I didn't even really think about that because with the 2+4, a lot of people are trapped, so they feel like they have to finish the PharmD. Obviously I did it because I wanted to, but there are some limitations. So you had the opportunity, and it I think it shows, that you really are dedicated to the profession of pharmacy, considering that you did finish it out despite your, ambitions beyond that. So kudos to you. But
Thanks, Nathan.
yeah, no problem. So I'm curious to know though, did you ever consider like pharmacy residency? Obviously, they have a little more agency in their practice, or were you already like just sold on the orthopedic track?
So I would say that I did consider pharmacy residency very early on in my career. I really liked the nuclear pharmacy. I really liked nuclear pharmacy because it's just something that seemed that I had no, it was something that seemed esoteric to me and that I had no background of whatsoever. So I wanted to kind of explore that. Also, I knew one of my classmates, her parents actually owned a nuclear pharmacy somewhere in Missouri. And
Wow.
I thought that was very, yeah. I thought that was very interesting. So I consider nuclear pharmacy. I also consider clinical pharmacy, very early on. But I wouldn't say I'm also sold on orthopedics, surgery on that pathway. But I'm very interested in pursuing a surgical pathway. But the drive to pursue a surgical pathway or the drive to, pursue medicine, I would say, kind of overtook any ambitions of becoming a clinical pharmacist. So, into my third year, when I started becoming a medical scribe, I did not entertain the thoughts of pursuing pharmacy residency.
Right. Yeah, for sure. It sounds like you had your eyes set on the horizon, and the pharmacy residency kind of, you thought through it, you considered your options, and then you looked beyond that. So that's awesome. And so I'm curious to know how was it like applying to medical school while simultaneously in pharmacy school? What were the challenges that you came across?
So I actually ended up applying to medical school right after I graduated. So I didn't apply while I was in pharmacy school.
Even better.
But
So
yeah, sorry, the
yeah.
challenges I came across were that, so one big challenge I came across was that a lot of my prereqs had expired.
Oh no.
So so like there's some medical schools for people who are listening out here who have prerequisite coursework for you to take. There's a lot of medical schools who have that. And there's some medical schools who have a deadline. They say that, you must have taken this course within the last 5 years. And for me, because as a non-traditional student who has gone through pharmacy school, I took those prerequisite coursework probably like around 6 years ago. So then I had to retake some of those. So that was what I was doing during my time off. And that's also kind of why I decided to apply after I graduated, because I wanted to fulfill some of those requirements.
Okay. Yeah, that makes sense. And so then did you take your MCAT at the same time period or a little bit before?
Yeah, so I took my MCAT right before I graduated from pharmacy school. I took it actually during my last APPE, so Advanced Pharmacy Practice Experience.
Okay. Yeah, that's what I generally recommend too to like all of our listeners is obviously you want to make sure you do well in the MCAT because that seems to be a major barrier to getting into medical school before you sign up for a lot of expensive prerequisites. So I'm glad that you did it that way. And you only took it once, I'm guessing?
So I took it twice. I took one that I decided to void the score, and then the second time I took it, I kept the score, and yeah, and that was what I used to apply with.
Fantastic. Yeah, that's it makes you wonder when you avoid a score for our listeners, you don't actually get the score report and it basically just cancels out the whole exam. So that's definitely a very difficult decision. What was going through your head when you were thinking about when you eventually avoided that exam?
Well, so I signed up for the exam during I think it was I took it during I think P3 year, and P3 year that was probably our hardest year in terms of coursework. We took a majority of our pharmacotherapeutic courses in our P3 year. So I was having some trouble with both preparing for the MCAT and studying for pharmacy school at that time. So I didn't feel that, I would have been able to do as well on the MCAT at that time.
Excellent. Excellent. Well, yeah, I'm glad that you were able to identify that. And sometimes it's too late where you can't move the exam or it'll cost a ton of money. So it might just be more practical to just sit there and void the exam versus, having to pay like removal fees and stuff along those lines. So that definitely makes sense. And I'm glad that you were able to, make time for the exam after that period. Um,
Right.
so I'm curious to know then, so you had like a year off basically while you were applying. Obviously, you had graduated at that point. Were you working as a pharmacist too, or were you just focusing on your courses?
So I spent that summer. So I graduated in May of 2021, and I spent that summer just doing all my medical school applications, secondaries, primaries, and I submitted everything by August. And then in August, I started working on some coursework. I was studying for the NAPLEX, but I also had medical school interviews at that time, so I was preparing for those too. I wasn't working as a pharmacist. I actually so I had my pharmacy intern license activated at that time. So I was working as an intern at Walgreens and at a private pharmacy and at an independent pharmacy in St. Louis.
Hmm.
And so my cycle, had to end early. It ended at December the 1st, I remember, because UMKC requires for us to drop our medical school acceptances by then, and drop all interviews, drop all the applications. Yeah, because they
Yeah,
start January the 3rd. So.
yeah. So let's explore that a little bit more. So I'm curious to know how many programs did you end up applying to? Was like UMKC the ultimate goal? Was that like your top school that you wanted to attend, or did you apply pretty broadly?
I applied very broadly, and I would have been fine, attending any medical school that was I saw as a good fit for me.
Okay, yeah. So then UMKC kind of like landed on your lap, and you're like, wow, I have an opportunity to start medical school a lot sooner than, most other people, and I can basically kind of get a jump start on my career. So why wait around for other, interviews or acceptances or anything like that so is that like the mindset that you were following?
Yes, exactly. Yep.
That's super cool. So like I mentioned earlier in the podcast, UMKC is one of two schools that actually does this off-cycle medical school education program. So do you mind telling the listeners a little bit more about that? And I guess so because of that, you, I guess, withdrew all of your other acceptances or any kind of potential opportunities to interview at other schools in like December. And then you basically enrolled and signed up and were starting medical school in January, which is super, super cool.
Yeah, so I dropped all the, interviews, all my applications on December the 1st. and just got ready to move to so actually attend the St. Joseph campus of UMKC. It's the rural medical campus, right now funded by a HRSA grant through the state of Missouri. So moved to St. Joseph, Missouri, and we started our coursework on January the 3rd. UMKC has this unique program where I believe we only get so we start January the 3rd, but we only get, I think, a total of 4 weeks of break throughout the whole year for the first year. So we start January the 3rd and we end on December the 16th. So from January the 3rd to December the 16th, we only get around 4 weeks of break time. The rest of the time we're in courses full time. But we also get early clinical exposures. So in our first year, we have to take this clinical coursework where we see patients. And then now we're even given the opportunity to independently see patients, do the HPI physical exam but then we'll report back to the physician about our findings. But so we get that very early on in our curriculum.
Wow, that's super cool. And so how big is your class size then? Is this like a larger program or do you have like a smaller group?
Yeah, my class size is only 21 people, but they're
Wow.
downsizing. Yeah, so I know that the new class that's incoming has only 16 people. So it's a small program. But there's people in my class who come from all over the US. There's people from California, from Illinois, from lots of other states. So yeah.
Wow, that's
So
super interesting. I'm
yeah,
used
so
to yeah, go ahead.
oh, sorry. So, like, if you're not from Missouri, I know it's a Missouri medical school, so in-state is always, kind of higher priority, I guess. I'm not sure too much about the missions, but also if you're from out of state, please apply because they do accept out-of-state students.
Yeah, that's super interesting. Yeah, 21 students. So, like, it seems so crazy to me because I go to a school that has 180 students per class, and I'm just like, I don't even know half of these people. It's just crazy. But I'm sure you have a
Yeah.
very close-knit connection, and I'm sure everyone's super collaborative because of the setting and the proximity to everyone else.
Yeah, I would say so. Yeah, that's definitely the environment that they tend to promote here.
Fantastic. So you had your first year already, and you're on break right now for the time being. So let's talk about that. How was your first year in its entirety? Were there any classes that you struggled with or found more challenging? Like I know anatomy is a big one.
So I would say that pharmacy school for me was easier than medical school. Um, I'm not sure if you would agree with that, Nathan. Um, Pharmacy school for me, the at least at my pharmacy school, the rigor and the pace was a bit it was not as much as, as medical school. Um, the main courses that I would say at the beginning, it was just the struggle of fitting in and, being so far away from home, um, getting acclimated to the speed, the rigor of the course, of our human structure function series, which is a mixture of anatomy, embryology, biochemistry, physiology, and histology. So it was, acclimating to this. That was a challenge at the beginning. But once I overcame that and was able to become acclimated to the demands of medical school, it ended up being okay.
That's great. Yeah, I always say like there's always going to be an adjustment period regardless of what kind of education you're getting. That first couple months, like getting adjusted to the volume of medical school can be a challenge for some people. In my experience I think like pharmacy school and medical school was similar with the first 2 years of didactic medicine. Obviously there's a little bit more volume with medical school, but that's kind of expected. And obviously having anatomy, like the courses are very different from a pharmaceutics course. I never had gotten any prior anatomy exposure, so I found that actually pretty challenging in my experience. So I guess I would agree with you, like it definitely was harder in some regards. When it comes to clinical rotations, hands down, medical school takes the title. They are definitely way harder, for our listeners. But not to scare you, Abby, but it's clinical rotations are quite a bit of work, but it's been a really rewarding process. So yeah, and you'll kind of get there, and you'll work your way up to that point. So are the clinical rotations any different from now that you're at like kind of an off-cycle medical school? Or is it all very much the same?
I'd say the clinical rotations are the same, but I haven't, progressed to that part of my clinical career yet.
Right, right. It's down the road. We'll worry about it someday.
Right.
Um, so then are boards any different either? When do you typically take boards? Like
I
with Assembly
believe,
1.
yeah, so I believe we take it a bit earlier, but please correct me, if I'm wrong. I'm not sure when you would take it, Nathan, but I know that there's people who so they're considered class of 2025, but they graduate in December of 2024, but they have already taken their boards, step one. They took the earliest, I believe, from our campus that took step one was a couple weeks ago in December. So,
Interesting. Interesting.
yeah.
Yeah.
So,
Technically
so
you
they
can
would
take
take
it.
it.
Yeah,
So
go
they
ahead.
would take in December of their second year.
Interesting. Yeah, technically you can take it, I think, all year around. But normally, like from I guess you could say quote unquote traditional approach, you could take it. We took it back in June of this year. So I've already taken step one. That's no fun, by the way. But but then I'll be taking step two in this coming June. But
Ah,
yeah, but I think with every medical school is going to be different, and I think that's the point of this discussion right here is that every medical school is going to have their different like quirks and stuff. Some schools have a 1.5 year of didactic curriculum, and then students like go on clinical rotations before they even take their step one board. So I think it's all just very different. So you have to kind of investigate each medical school and see, how they kind of play out with their boards and whatnot. But at the end of the day, the result is all the same.
right. And I'd like to add that I think it's really important when you're interviewing for medical schools to ask what's the dedicated time you get for studying for step one or step two, because that's very important. These exams, they require full-time studying, and I'm sure Nathan could comment more on that.
Yeah, that is an excellent point right there. And I think it's going to change a lot because step one is now pass fail. So, in my honest opinion, I don't think that we need a fully dedicated period of time. We got 6 weeks of dedicated study periods. And for step two, we get no time off. So it just seems kind of counterintuitive, that we would get so much time off to study for an exam that's pass fail, where like of course, like it's a very high stress exam that needs a lot of preparation, but I don't know if it necessarily warrants as much time as we were given. Versus I feel a lot more stressed for step two because that is now our only defining course grade that kind of dictates whether or not we'll get a residency. So I'm a lot more stressed for that, and I'm going to finish rotations on that Friday and take the exam on Monday. So
Oh, goodness.
so I think that's something that's going to be very dynamic. It's going to be changing for a lot of programs. But some schools already have this in place. I have a friend who goes to osteopathic medical school, and he gets like 3 months off for step two dedicated. It's like a crazy amount of time, to the point where I was like, oh man, like you're going to be bored. But so I think that's a great point to bring up. Make sure you ask about that. But the big things would be like making sure you're a good fit for the program.
I definitely agree. That's very important. And also just from, I've actually spoken with some of the missions people at my school, and then they say that they definitely look for fit. That's very important.
hmm So I'm curious too. So do you have any recommendations for students listening in? Like what can make them more competitive to get into medical school?
I would say the PharmD is definitely something that stands out. And especially if you can work your way work kind of incorporate why the PharmD helps you stand out more as a physician. It makes you a really good candidate and someone who's very desirable for medical school because not many people have this experience. Not many physicians even have this experience of a PharmD. They don't have that knowledge of the pharmaceutics, pharmacokinetics, pharmacotherapeutics. So if you can make that a selling point of your application of how your knowledge from pharmacy would benefit your practice as a future physician, I think that would be very good and very solid.
Yeah, I usually term that the hybrid approach or the hybrid argument in the sense that 1 + 1 = 3.
Right.
PharmD plus physician education equals better physician. For simple math. But you're definitely right. Like I'm curious to hear, well, I'll ask you this in a second, but in my experience, there wasn't like a crazy amount of pharmacy education, at least in the didactic portion of my schooling. So because of that, I think a lot of physicians don't have the, like you said, the same kind of foundational pharmaceutical background that might make them better physicians down the line. So obviously, I just shared my experience, but how has that been for you? Have you had a lot of pharmacy integrated into your program?
So actually we do. So UMKC, we already took our intro to pharmacology course. It's the pharmacy curriculum in our schools are all taught by PharmDs. So we will have a intro to pharmacy. So we already had an intro to pharmacology course already in our first year. And then we will have a 2 month long pharmacology course, which incorporates clinical pharmacy, pharmacokinetics, just everything that's required, that basically so much that you learn in pharmacy school into that short 2 month period. Um, and then I believe that we'll be taking pharmacy, self-paced pharmacy courses like prescribing, safe prescribing of medications the next, um, throughout the remainder of medical school here.
Wow, that's awesome. So all the courses were taught by other PharmDs. I think that's just
Yes.
so important. And that's something I keep harping on my university. Don't get me wrong, I go to a great program, but I think that's something that they could definitely improve upon because a lot of ours were taught by PhDs, and they're very good with the technical stuff, but I think PharmDs are the ones who kind of integrate the clinical and the technical. So I think that's something that I've definitely missed out on, and I hope that they'll make some adjustments to that in the future, or at least get some external PharmD like expert opinions involved in the curriculum. So I think that's super cool that you had that opportunity to have that.
Oh, thanks. Yep. Yeah, I do too.
So I guess kind of going back to medical school, what do you have coming up for the next cycle? You're talking about a little bit about courses, but what any like, organ-based system modules coming up that you're looking forward to?
Yeah, so we have our pathology course. So it's our second pathology course. We took our first this fall. We have our second pathology course this spring, where they go into the disease states of various organ systems. And then we also have our medical microbiology course. And then we continue with our clinical based courses.
Okay. And then I'm sure they like integrate like obviously pharmacy and histo and other kinds of principles in there. What were your thoughts on histology?
I liked it. So I took histology in pharmacy school too. It was one of the hybrid electives that you can take either as an undergrad or in pharmacy school. So I took that and I liked it. I liked seeing on a microscopic level the pathological states. I liked it.
Yeah, and I think that's something that a lot of pharmacy students listening in probably aren't familiar with histology. That's crazy that you were able to take a course in histology that was a hybrid. It sounds like your pharmacy school is very progressive in the sense that you can kind of customize your experience. Again, not to complain about mine or anything like that, but I felt like it was a lot more regimented. So that's very cool that you're able to do that. Yeah, histology is like basically the looking at cells and pathology and helping identify I guess like different diseases, and there's some very characteristic cells and features that helps you identify tissue, helps you identify, different pathology. So it's very interesting. It's a very niche field of medicine, but it's cool that we get a lot of exposure to it early on. So so obviously that you're looking forward to some of these courses coming up. Are you looking forward to clinical experiences too, like rotations?
Oh, that's something that I'm very interested in, and I'm very looking forward to. That's the, crux of why we want to be physicians, right? Is the clinical aspect and to be able to help heal patients and help them, along their healthcare journey. So that's the thing that I'm most looking forward to, I'd say.
Yeah, and getting out of the classroom has its merits.
Oh,
It's
yes.
very nice to actually be out in the field doing things. There's a lot of variability with each day, so it makes it just a very cool, unique experience. Um, so what kind of specialty are you interested in? You mentioned that you're interested in surgical and pretty broadly, but if you had to choose today, what would it be?
So this is something that I try to keep an open mind with, but I've always been interested in the brain and neurology, neuroscience. I love, you know, learning about this complex organ that's between our 2 ears. So the field I've always been passionate about is neurosurgery, neurological surgery. So that is the field that if I can choose today, that's the field I would go into.
Yeah, I was super interested in neurosurgery up front too. It's a long trek, but if you have the passion for it and the commitment, then absolutely follow your dreams. For our listeners, the average so neurosurgery is 7 years, and then most people will also consider fellowship to further specialize into particular like endovascular or maybe spine or something along those lines. So depending on, the neurosurgery program, it can be anywhere from, 7 at a minimum to, 9 years because fellowships can be 2 years long. And that's post graduation. So don't get me wrong, very long track, but very rewarding field too. So what I guess got you involved? What sparks your interest with surgery particularly? I think like the textbook example of pharmacy is that a lot of people will want to go into internal medicine because they're so closely related. So I'm curious to know like what sparked your interest in surgery?
So I should clarify that I'm not only interested in surgery, I'm also interested in internal medicine, neurology, especially pediatric neurology. Um, but for me, surgery is something that allows me to actually make an actionable change on patients and to be able to fix things and right away use that anatomical knowledge that I acquired to be able to um, make an immediate change, immediate remedy to a patient's issues. With pharmacological therapies, it's more trial and error. There's a lot of side effects, also with surgeries as well. But I'm someone that I like surgery. But I also like internal medicine and the complexities of the human physiology. When you're trying to figure out what is the best or what is the optimal drug regimen for them. So, I would say I'm very interested in both, and I'm just, waiting for medical school to reveal itself. What is the optimal specialty for me to pursue?
Yeah, I think that's a really good approach to things. Some of your peers might like walk into medical school day one and know for sure that they want to do X. But I think that, for me, in my experience, I'm more along the same lines as you, where I wasn't really sure what I wanted to do. They kind of tell you to kind of think down the lines of, are you going to be a surgeon or are you going to do something outside of surgery? So like, and then I still couldn't narrow it down to that. I was still interested in surgery at one point in time. But so I think like as you progress through, I was working more along the lines of not like I guess like crossing things out more so than I was like ruling things in. And that's where I've kind of like come to the line where like I really don't like this, so let me think about something else. And I think you'll have a similar experience as well. So when you get to clinical rotations, that's going to be the real litmus test to tell you like, hey, I can live a life like a surgeon, or I can do internal medicine because this really fits my how I want to live my life and what kind of specialty interests me. So you've got time. Don't worry about any of that. But having a broad perspective and casting a wide net, I think, is a good idea. So, and it sounds like you're employing some of that right now. So awesome. So I also take it that you're obviously interested in helping students because you're participating in the podcast today. So I'm curious to know, how do you plan on staying connected with like the pharmacy community?
Oh, definitely. So I still stay connected with a lot of my colleagues from pharmacy school, a lot of the professors as well. I've always been really interested in pharmacokinetics. So I love, math and biology. Those were my favorite subjects, growing up. So pharmacokinetics is just a marriage of that. So I've been thinking of some projects I could do with pharmacokinetics and, just keeping in touch with the pharmacy base there. So definitely, continuing to keep up to date with the clinical practice guidelines, pharmacotherapies, new drugs that are coming out, and also with my pharmacy colleagues.
That's great. And I'm curious to know too, like a lot of people will complain, or I guess when they're first making the decision of switching into medicine, did you get any traction from any like pharmacy personnel or people in the profession of pharmacy, or was everyone you came across very supportive?
I'll always say that in life, people are not, there's going to be people who are very supportive of you. There's going to be people who are not supportive of you. And you have to weigh both. There's people who aren't supportive because they believe that, you have a great career in pharmacy, why switch? It's going to add on to the year, it's going to add on to debt and things like that. And just weigh all that in mind. There's also people who would say that, if you really have this passion for medicine and, you know, let's say you reach 35, would you rather be a doctor, or would you rather be continuing to practice as a pharmacist, but with less debt, and more financial backing? So it's a I would say it's this balance that you have to weigh. And there's going to be people that's going to be supportive, that's not going to be supportive of you, but ultimately at the end of the day, it's your life. So just choose whatever your passion is.
Absolutely. I agree with that in the sense that, all feedback it can be useful in to some regard. Some people might be a little more resistant to you making that change because it is something very dynamic and very scary for people who haven't gone down this path. Going from pharmacy to medical school is not a very common path, and so I think it's basically the unknown for some, especially for people who are in the pharmacy world for so long. So they think it might not be the best option, but I think you can learn a lot from your critics, and you can learn a lot from, just they might bring up some really good points that you might not have considered and may turn you away from going down this career. So I think you got to consider everything. You can't always just go with the people who are pushing you, go, 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 go. Sometimes you need to pump the brakes and think about, is this really what is going to be right for me? So the first time on the podcast, I'm saying don't always into medicine. But I think like you can still have a very rewarding career, and I still, of course, endorse it. But I think that's important, to consider some of the criticism or some of the red flags associated with going down this pathway. So I'm glad that you didn't heed any of the advice of some of them, but and here you are. I think you made the right decision. Maybe hopefully you do as well.
I definitely do. Thanks.
All right, so we're coming to the end of the podcast right now, and I just want to ask you a few more questions. So, I guess where would you like to see yourself in the next 5 years? Do you want to stay in the area that you're currently living in? Do you want to kind of travel around, or obviously you want to match into the residency of your dreams? That's kind of a given, but yeah, just tell me a little bit about that.
I'm very open to what the future holds. This is something I've learned, that it's that no matter how much you want to control the future, you can't. So in 5 years, I see myself hopefully graduating from medical school and pursuing the residency, that I believe is the best fit for me, and that the residency directors also believe is the best fit for me, somewhere. So we'll see. I can't choose where I match in for residency. I might have some input, in terms of my application preparations and how I interview and things like that, but ultimately it's not only up to me. So I can't say I know for sure, but I'm always excited for the future.
It is kind of crazy how we sign up for this life of uncertainty, but like you said, good preparation, smart applications can kind of lead to better outcomes when it comes to placement with residency. And for our listeners, generally speaking, your best chances are always at your home institution. So, keep that in mind. Like, obviously, you're going to take the acceptance for a medical school acceptance where you get in, but, a lot of people end up staying at some of those programs afterwards because of the benefits of sticking around. Because of course, the medical school knows you, so the residency directors will know you because you've worked with them before. So that's just another kind of tidbit that you might want to think about, when it comes to choosing a medical school in the future. Do you really want to end up all the way across the country? When realistically you might end up at that residency program forever. Granted, if after you've been there for so many years, it might just become the second home to you, but just something to think about. So I guess last question for you today. Do you have any last minute advice for pharmacists interested in pursuing a career in medicine?
I would say that so my only piece of, I would say, advice or suggestion is that pharmacy is it's a va very valuable career. So if you are looking to make that switch into medicine, always look into answering the question, why medicine? Because a lot of all the medical schools that interviewed me, they asked me, I have such a great career in pharmacy, why switch? So always be prepared to ask that question, and always just prepared to be prepared to answer about why you think that having a pharmacy background makes you such a much more solid candidate But otherwise, everyone's roads are their own, and I really look forward to hearing about everyone else's journeys and learning from them as well.
Fantastic. And I shouldn't have said last question because I am curious too. Do you plan on working as a pharmacist during medical school? That's always a question people like to hear the answer to.
So, I'm not licensed right now. I ended up not taking the NAPLEX prior to matriculation in January
Hmm.
to medical school, but I'm planning on taking my licensing exam right after I graduate. So remember that UMKC allows us to graduate one semester early.
Hmm.
So I'm planning on taking a couple, some time off to study for the NAPLEX, take it, and then work as a pharmacist all the way up until residency post graduation.
Yeah, in the pre-show notes before we were talking about on a live mic, yeah. So Abby's actually going to have a couple months off prior to applying to residency, and I guess until match day. And then obviously a couple months after that as well. So it's pretty unique, and it sounds like a great idea to work and make some money, build up some time, and that way you can go on some vacations before the big residency hustle.
Right.
Alrighty. Well, we've come to the end of the interview, and I'd like to thank all of our listeners for the support. If you have any additional questions about the medical school journey, check out my website at www.physicianpharmacist.com. Before we let you go, Dr. Jin, how can our listeners get in touch with you or hear more about you?
Yeah, so definitely always feel free to send me an email if you have any questions about applying to medical school or about my journey or just anything in general. My email is abbey.jin42505 at gmail.com. And Nathan will provide written text too.
Yeah, for sure. I'll drop that in the show notes. So again, thank you for being on the podcast, Dr. Jin. I recognize you're extremely busy. You don't have a lot of time off with your schedule. So thanks for taking the time today to be on the show and share your insight.
Thank you, Nathan.
All righty. Take care and happy holidays.
You too. Thank you. Bye.
All right. Bye-bye.